There are a few things more unsettling for a cat owner than walking into the kitchen, filling the food bowl, and realizing something isn't right. Usually, your cat is already there. Maybe they're weaving between your legs. Maybe they're meowing impatiently or rubbing against the cabinets, reminding you that breakfast is overdue. But today, the bowl stays full. You open a fresh can of their favorite food. Nothing. You shake the treat bag. Still nothing. You even offer a piece of cooked chicken, the one snack they almost never refuse. Instead of running over, they simply glance at it, then quietly walk away. At first, it's easy to dismiss. Maybe they're just being picky. They probably ate outside. They'll eat later. But here's something every cat owner should know. Cats are masters at hiding illness. In the wild, showing weakness made an animal vulnerable to predators. Even though your cat sleeps on a soft bed and lives safely indoors, those instincts haven't disappeared. Long before a cat cries, limps, or obviously looks sick, they often do something much more subtle. They stop eating. And that's why veterinarians take a loss of appetite far more seriously in cats than many people realize. Because sometimes refusing food isn't the problem, it's the warning sign. The real problem may already be developing silently inside the body. Today, we're going to uncover what your cat might be trying to tell you, the hidden diseases that often go unnoticed, the emergency warning signs every owner should recognize, and when waiting until tomorrow could become a dangerous mistake. Because when a cat stops eating, time matters. One of the biggest misconceptions about cats is that they're simply fussy eaters. Yes, cats can be selective. Some refuse food because it's served in the wrong bowl. Others suddenly decide they no longer like the brand they've eaten happily for years. But a healthy cat rarely chooses to stop eating completely. A complete loss of appetite is different. Veterinarians call this anorexia, and unlike in humans, it doesn't necessarily mean a psychological eating disorder. It simply means the cat has stopped eating altogether, and that single symptom can be linked to dozens of different medical conditions. Some are relatively minor. Others require immediate treatment. The challenge is that cats don't tell us where it hurts. They simply become quieter, sleep more, hide longer, eat less. By the time owners notice something is wrong, the illness may have been progressing for days. That's exactly why experienced veterinarians often say one sentence over and over again. A cat that isn't eating is never something to ignore. But why is it so dangerous? After all, dogs sometimes skip a meal and seem perfectly fine. Cats are different. When a cat goes without food, the body begins searching for another source of energy. Fat stores are released into the bloodstream and sent to the liver to be processed. Normally, this isn't a problem, but cats aren't particularly efficient at handling large amounts of fat all at once. If they stop eating for too long, fat begins building up inside the liver instead of being processed normally. This condition is called hepatic lipidosis, often known as fatty liver disease. It's one of the most common and most serious consequences of prolonged appetite loss in cats. What's especially concerning is that hepatic lipidosis can develop surprisingly quickly. A cat that already has another illness may stop eating because they don't feel well. Then the lack of food creates an entirely new life-threatening condition on top of the original disease. That's why veterinarians don't just ask, "Why isn't your cat eating?" They also ask, "How long has your cat gone without eating?" Sometimes that answer changes everything. Now let's talk about one of the most common hidden reasons: dental disease. Many owners never look inside their cat's mouth. Even if they do, the teeth often appear perfectly normal from the outside. But beneath the gum line, painful infections, broken teeth, inflamed gums, or damaged roots may already be developing. Imagine trying to chew every meal with a severe toothache. Eventually, you'd stop eating too. Cats experience the same thing. Some cats approach the food bowl with obvious interest. They sniff the food. They may even try to take one bite, then suddenly pull away. Not because they aren't hungry, but because chewing hurts. Others begin dropping food from their mouths. Some chew only on one side. Others drool more than usual or develop noticeably bad breath. These subtle clues often point toward pain rather than stomach problems. Fortunately, dental disease is one of the most treatable causes of appetite loss once it's properly diagnosed. But not every hidden illness is that simple. As cats grow older, another silent disease becomes increasingly common: chronic kidney disease. The kidneys act like your cat's natural filtration system. Every day, they remove waste products from the bloodstream while helping maintain the body's delicate balance of fluids and minerals. The problem is, kidney disease develops slowly, often over months, sometimes over years. During the early stages, there may be almost no obvious symptoms. Owners may simply notice their cat drinking a little more water, sleeping a little longer, losing a little weight. Then one day, the appetite disappears. By that point, waste products that should have been removed by healthy kidneys begin accumulating inside the bloodstream. These toxins make cats feel nauseated. Food no longer smells appealing. Some cats even begin associating eating with feeling sick afterward. The result? The food bowl remains untouched. Many owners assume aging itself is causing these changes, but growing older should never mean losing interest in food. Loss of appetite is not a normal part of aging. It's often the body's way of asking for help. And kidney disease isn't the only condition that quietly steals a cat's appetite. Liver disease can do the same. Unlike the kidneys, the liver performs hundreds of different jobs inside the body. It helps digest nutrients, stores vitamins, produces proteins, removes toxins, supports the immune system. When liver function begins declining, appetite often declines with it. Some cats develop vomiting, others become unusually sleepy. In more advanced cases, owners may notice a yellow tint developing around the eyes, gums, or ears. This condition, known as jaundice, signals that the liver is struggling to do its job properly. But here's what's frightening. Many cats lose their appetite long before jaundice ever appears. The body whispers before it screams. Recognizing those whispers can make all the difference. Then there's another disease that frequently surprises cat owners: hyperthyroidism. This condition is especially common in older cats. Early on, these cats often eat more than usual. They seem constantly hungry. Yet, despite eating more, they continue losing weight. Many owners assume their cat simply has a fast metabolism. Eventually, however, the disease begins affecting the entire body. The heart works harder, blood pressure rises, muscle mass decreases, and in later stages, appetite may suddenly disappear altogether. By then, what first looked like a harmless increase in hunger has become something much more serious. The body had been giving clues all along. Most owners simply didn't know what those clues meant. But kidney disease, liver disease, and hyperthyroidism aren't the only illnesses veterinarians think about when a cat suddenly loses its appetite. Sometimes the problem isn't a failing organ at all. Sometimes it's hidden deep inside the digestive system. Imagine swallowing every bite of food, only to have it painfully struggle through your stomach or intestines. After a while, your brain would naturally begin associating food with discomfort. Cats experience the same thing. Inflammation of the stomach or intestines, inflammatory bowel disease, stomach ulcers, parasites, or even a foreign object trapped somewhere in the digestive tract can all make eating feel unpleasant. In the beginning, the signs may be almost invisible. Your cat may sniff the food, lick it once or twice, then quietly walk away. Some cats will vomit occasionally, while others become constipated or develop diarrhea. The challenge is that digestive diseases rarely announce themselves dramatically at first. Instead, they slowly steal your cat's appetite day after day until owners finally realize something is seriously wrong. One condition veterinarians are especially careful not to miss is an intestinal blockage. Cats are naturally curious. They investigate the world with their paws and mouths. String, ribbon, sewing thread, hair ties, rubber bands, toy parts, plastic wrappers, and even holiday decorations can all become dangerous if swallowed. Unlike food, these objects cannot move safely through the intestines. Instead, they may become trapped, partially or completely blocking the digestive tract. At first, your cat may simply stop eating. Soon after, vomiting may begin. The abdomen may become painful. Energy levels drop. Without treatment, the intestine itself can become damaged, cutting off its own blood supply. This is one of the reasons veterinarians often ask owners a question that seems surprisingly specific. Has your cat been playing with string lately? It sounds simple, but the answer has saved countless lives. Another disease that quietly hides behind appetite loss is diabetes. Most people associate diabetes with excessive thirst or frequent urination, and those signs are certainly common. But many cats also lose interest in food as the disease progresses. Without enough insulin, the body struggles to use glucose for energy. Even though plenty of sugar remains in the bloodstream, the body's cells are effectively starving. As a result, cats begin losing weight, becoming weaker, and eventually eating less instead of more. Some owners notice that their cat seems thinner every week despite no obvious changes in diet. Others simply notice that their once energetic companion now spends most of the day sleeping. These changes often develop so gradually that they become the new normal, until one day the food bowl remains untouched. Then there's a diagnosis that every pet owner fears hearing. Cancer. The word itself is frightening, but it's important to remember that appetite loss alone does not mean a cat has cancer. Far from it. However, many types of cancer eventually affect eating. Tumors inside the mouth can make chewing painful. Tumors affecting the digestive system interfere with normal digestion. Other cancers release inflammatory chemicals that suppress appetite throughout the entire body. One reason cancer is so difficult to recognize early is that the first signs are often vague. Slight weight loss, sleeping a little more, reduced interest in food. Small changes that are easy to overlook when viewed individually. But together, they begin telling a very different story. This is why veterinarians always encourage owners to look for patterns rather than isolated symptoms. A single skipped meal may not be alarming. A week of gradually changing behavior is something else entirely. Now let's talk about something many cat owners never consider: stress. Like, cats thrive on routine, a new pet, a new baby, moving house, renovations, visitors staying overnight. Even something as simple as relocating the litter box or changing food bowls can cause significant stress for some cats. Unlike humans, cats don't always express anxiety by becoming restless. Many withdraw, they hide, they become quieter, and sometimes they stop eating. Stress-related appetite loss can often improve once the underlying cause is addressed. But it's extremely important not to assume stress is the explanation before ruling out medical disease. Too many serious illnesses have been mistaken for just stress. That's why veterinarians first try to answer one important question: is this behavioral or is it medical? The next question every owner asks is, when should I call the veterinarian? The answer is much sooner than many people expect. If your adult cat refuses food completely for an entire day, or if a kitten stops eating for even a much shorter period, it's safest to seek veterinary advice promptly. Young kittens have very little energy reserve and can become critically ill much faster than adult cats. There are also certain warning signs that should never be ignored: repeated vomiting, difficulty breathing, collapse, extreme weakness, a swollen abdomen, continuous hiding, signs of pain, yellow gums or eyes, difficulty walking, or any sudden change in behavior that simply doesn't feel normal. Owners know their pets better than anyone. If something feels wrong, it's worth paying attention to that instinct. When you arrive at the veterinary clinic, the examination usually begins long before any tests are performed. Your veterinarian watches how your cat walks into the room, how alert they are, whether they respond to sounds, whether they're dehydrated, whether they've lost weight. Every small observation provides another clue. Next comes the physical examination. The mouth is checked for dental disease. The abdomen is gently felt for pain or abnormal swelling. The heart and lungs are examined. Temperature is measured. If needed, blood tests may be recommended to evaluate the kidneys, liver, blood sugar, thyroid function, and signs of infection. X-rays or ultrasound imaging may help identify intestinal blockages, masses, or other hidden problems that cannot be seen from the outside. Many owners worry that these tests are unnecessary, but remember, loss of appetite isn't a diagnosis. It's only the symptom. Finding the underlying cause is the key to choosing the right treatment. And treatment can look very different depending on what's discovered. A painful tooth may need to be removed. Kidney disease may require long-term management. Hyperthyroidism has several treatment options. A foreign object could require emergency surgery. Stress-related appetite loss may improve with environmental changes and supportive care. The important point is that there is no single cure for not eating. Every successful treatment begins by identifying the real reason your cat stopped eating in the first place. Fortunately, there are also ways to reduce the risk of many illnesses before they become emergencies. Schedule regular veterinary checkups, especially for older cats. Monitor your cat's weight instead of relying only on appearance. Provide fresh water every day. Keep toxic plants, medications, and household chemicals out of reach. Avoid leaving strings, ribbons, sewing thread, or hair ties where curious cats can swallow them. And perhaps most importantly, pay attention to small changes. Cats rarely become seriously ill overnight. Most diseases whisper before they shout. A slightly smaller appetite, sleeping a little longer, drinking a little more water, becoming less interested in play. These tiny changes often appear weeks before obvious illness develops. Recognizing them early can dramatically improve the chances of successful treatment. So if your cat suddenly stops eating, don't assume they're simply being picky. They may be trying to communicate in the only way they know how. They can't tell you where it hurts. They can't explain that they're nauseous. They can't say they're in pain, but they can stop eating. And sometimes that's the loudest cry for help they'll ever give. The sooner that message is recognized, the sooner your veterinarian can uncover what's really happening, and in many cases, the better your cat's chances of making a full recovery.